You're live.
Hello, good afternoon, everyone, and welcome to another Tompkins County Government Community Town Hall. We're always happy to come before our community to answer questions and to share whatever information we have, especially during this very, very difficult time that we've all been experiencing over the last year and more. When we last hosted a town hall, vaccine distribution was just beginning. We were just at the start of it. Dr. Stallone, if you remember, those of you who were there from Keuka Health Systems, joined us for the discussion on the plans for vaccine distribution. We were hopeful, we were excited and ready to launch our mass vaccine distribution plans that the county had developed and has had in place over many years. Today, we are over a month into the distribution efforts. There have been many, many lessons learned, encouraging successes, as well as lots of frustrations, some halts, some shifts. If COVID-19 has taught us anything, is that on the drop of a dime, we have to pivot. And we have been doing that. Tonight, we will look to hear from our community leaders on how things are going so far, what the status of eligibility is at this point in time. That keeps changing rapidly as well. And what is our vision and hopes for the coming months? For many of us with the vaccine, we know it's a little bit of hope. We see a little ray of sunshine, and we're sure that there's more to talk about. Joining me today on this call, on this town hall, are Jason Molino, County Administrator, Frank Krupa, our Public Health Director and Mental Health Commissioner, and Amy Hendricks, our Deputy County Administrator and the person who also heads up our Emergency Operations Center. Thank you all for joining us. And behind the scenes, navigating this electronic stuff and make sure this technology that works for all of us is our Director of Communications, Dominic Recchio, as well as Shannon Alford, who works with our EOC and in communications as well. So thank you all very, very much for joining us. And Frank, why don't you just go ahead and kick off with any thoughts you have?
Great, thanks, Leslyn. And unfortunately, I've got to start off with a bit of bad news. Our allocation of 1,100 first doses that we had hoped to administer on Friday, unfortunately, is not going to make it to us. Due to the weather concerns in the South and really across the country, there's been distribution issues with getting the vaccine delivered. So New York State alerted us today that we would have to cancel all of our first dose clinics that were scheduled for this week. And we won't really know more until likely next week about when we'll be getting additional first doses because of those weather delays. So that's the bad news. So for anyone that has registered for the mall site, you're not losing your spot. We have those registrations and we'll just carry those forward once we know when our next clinic will be. So, just hold tight. We did do a robocall to those individuals today to make them aware, as well as the press release that we put out. So we'll be reaching out to those individuals to alert them on when the next available clinic will be. So we will get them taken care of. There is a bit of good news. The 200 doses that the state had allocated for the pop-up at the Beverly J. Martin Elementary School in conjunction with GIAC, CHS, and Ithaca City School District is still going to go on. Those 200 doses were already in New York and were being reallocated for that purpose. So we're expecting to pick those up tomorrow, and we'll still be able to do 200 doses at BJM on Friday. We've reduced the hours from 10 to 2 because we're only doing 200 people, and we're partnering with GIAC to get folks into registered for that pod. So little bit of bad news, a little bit of good news, and we just encourage folks to please be patient as we navigate all of this. Probably another bit of really good news, disease incidence is going down. We've had a few days now with single-digit new cases. I think we're down to about 150 active cases in the county. So these are the lowest the numbers have been since back in November, early November, which is really good. And we're happy to see that. So some good news on the disease front, and let's hope that continues. And coupled with getting folks vaccinated, we'll be heading towards the light at the end of the tunnel. We have been able to vaccinate over 9,000 people to date in Tompkins County, so that's really good. And we've got some 6,700 that have already received their second dose. So we're making really good progress with the vaccine, and that's some really good news. And so I think that's kind of where we are both from the disease and the vaccine front. As it has been, a little bit of good news mixed in with a little bit of bad news, but we'll keep moving forward and vaccinating people as quickly as we can.
All right, Frank, I was about to rethink starting with you when you started off with bad news, but you ended with good news and the number of people that we've vaccinated. So, the scales, tipped a little bit on that one. So thank you. I'm glad that we're doing such a robust job in Tompkins County to the extent that we're able to with the vaccines that we get. Jason, would you like to share some opening thoughts as well?
Frank really, I think, touched on some the key points that I think people are looking for. The only thing I would continue to add is that, we have the infrastructure in place to be able to vaccinate more people when the supply increases, and that is a good thing for our community. So while it's disappointing, and understandably that the weather has maybe caused a delay in these 1,000, 1,100 that we were supposed to get, when we get it next week, we'll be able to administer those plus whatever we get that following week. That's because we have that partnership with CHS, the health department, and we're prepared to do it. So that's the good news that I would add to Frank's contribution. The other thing I would also add is that continue to have some patience. We continue to ask the state probably on a daily basis for more doses, and we're doing fairly well compared to our counterparts in the southern tier, and we'll continue to ask for more doses. So that's the only thing I really have to add. I think Frank covered kind of most of it.
Okay. Thank you. I'm sorry, Jason, you said you were continuing to ask for more, and we're doing better than our neighbors in the southern tier.
We continue to ask almost to the point to where it probably bothers our state partners, but they know that we can distribute it. We can administer more vaccines. So on a weekly basis, we're asking for more. And we generally are getting a little bit more on our base amount every week than most of the surrounding counties, which is fine by us, and we'll continue to administer. And the more they give us, the more we'll administer.
Okay. Thank you.
Sure.
Amy, anything from you?
I think it's probably time to go to the questions. It sounds like we're getting floods of questions in the chat, as well as we have a lot of questions that have come in. So
okay.
Happy to jump in there and try to respond to a lot of the questions.
All right. Why don't you go ahead with that?
All right. So we'll start with talking a little bit about current disease, and then we'll jump into the vaccine questions. And I think that's where a majority of the questions are. But let's start with what's going on right now. And so, Frank, can you talk to us about how we're doing as far as COVID response and disease prevalence right now?
Yeah, as I said before, the numbers are heading in the right direction. We're in single digits each day, which is really good. We just came off of the holiday peak where we had our largest case numbers because of holiday gatherings and just the winter season. Students have returned, and so we did see some cases identified at re-entry which has kept our number a little higher than what our community number might have been. The good news is our higher ed have great procedures for identifying early and isolating and quarantine. So we're now through that re-entry process of folks coming back, and our numbers are low. So hopefully they'll stay that way as we continue moving forward.
Right. And Frank, has the college return impacted our cases at all?
It did. Certainly in the month of January and beginning of February, we saw cases upon reentry. Fortunately, our community numbers were already heading in the right direction. And so it wasn't a giant leap or anything that was really noticeable. It kind of looked to just continue our December and January numbers. But really it was influenced by reentry. But again, our higher ed did a great job containing that. And now we've seen over the last few days, now that reentry is complete, our true community disease numbers, which are low.
Okay, and a little bit about those disease numbers. Any relevance, what are we seeing in those cases? Are they tied to anything? What do we know about that?
Yeah, over December and January, it was about gatherings. We knew it would be of many different types, both holidays and others. And then as reentry occurred, we saw, students returning that were positive upon reentry. But now that we're in single digits, it's hard to really draw any conclusion because there's so few cases. So let's hope that we continue to not be able to know kind of what the trends are because the numbers are so low.
Okay. Leslyn, I'm going to turn it to you to talk a little bit about the vaccine and kick us off talking about eligibility. And Leslyn's saying profound things over there. We know.
I am. I'm being very profound. Jason, I'm going to ask you this question, actually. Can you explain how or why the county is only allowing certain groups to get vaccinated in 1B?
Yes. So part of it, the largest part about it is the lack of supply. So we're trying to identify subgroups in 1B, phase 1B, giving them specific links to register versus an open public link so that we can minimize the chaos and the congestion and the frustration with registration. So we identify specific subgroups, communicate to those subgroups, and then provide them with those links. The other part of it, and which I think is a question later on, is that we are prohibited from, at the local health department level, prohibited from registering or vaccinating the 65 plus population. So in this case, it's really trying to minimize the challenge of registration by narrowing the groups that can register for the limited amount of vaccine that we have.
Okay. And how are essential workers prioritized? How are they being prioritized?
Sure. So 1A obviously is hospital, frontline hospital workers that are being vaccinated by the hospital. 1B is again based on supply. We're limiting and identifying some of those groups within 1B, which is 1B is identified by the state as to who fits within that. And then from within those subgroups, we prioritize those. So what can happen is after 1 or 2 weeks of access to vaccines, we then move on to another group and then another group within 1B. So then within a matter of time, we'll be able to get through the essential workers in phase 1B.
Okay. All right, Frank, I'm going to turn to you and ask, when will you include in-person college instructors to the weekly distribution?
Sure, those folks are part of the 1B essential worker group. We are working our way through that group, and we will get to higher education. What we've been trying to do is make sure that we substantially complete the other groups before we move on to the next one. And so as folks know, we were prepared to do grocery workers and pre-K through 12, and there was still very high demand in those groups, which is why they've been on the list, at least pre-K through 12 for several weeks now. Once we feel like we've substantially hit those groups, then we'll move on to other eligible populations. So it really will depend on the demand associated with the groups that we're working through now.
Okay. And if you know off the top of your head about what percentage of groups 1A and 1B have been vaccinated so far?
Yeah, it's hard to know a percentage because we don't really know how many there are of each of those groups. We have rough estimates. What we do know is because we're giving exclusive links to those groups through their employers, we know that those groups have had multiple hours and in some cases a full day of access to a link to themselves, and all of the slots have not been used up. So we feel like we're using that mechanism as a way to know if we've substantially hit that population, understanding we know it's not everybody in that population, but it's enough that we can move on to the next group.
Okay. All right, Amy, I'm going to turn it over to you for additional questions.
All right, I'm going to jump in on some of the questions we just got in. Frank, how do you register for the vaccine, and how are people notified when it's their turn, when they're eligible to get it through the Tompkins County or through other locations? How do they find out?
Sure. So for all of our local, the combined Cuyahoga Health System and Tompkins County process, we're creating links, and then we're working through employers, because for both 1A that the hospital is responsible for and 1B essential workers, these folks are eligible because of their occupation. And so we've been working with businesses that employ these individuals to give them the links to distribute to their staff for them to then register using that link. So that's the process we've been following. As far as the pharmacies, they each have a little bit different process. You have to kind of go to their website and see, what you need to do, if they have a phone number or if you apply online. Of course, the state, there is a phone number that you can call, the state number. And then there's also, you can go to the website where the am I eligible, which then shows you any slots that are available to any site across the state operated by the state.
And what about those people with the comorbidities that we've prioritized the 65 plus, but with comorbidities, how do they know when it's their turn, or how do they get notified?
Sure. So we have focused on the 65 plus, which gives us a bit of an understanded group. We had planned to start with our senior living facilities here this week with Titus Towers and McGraw. So we've been working with the people that operate those facilities. Unfortunately, we're not going to be able to do them this week because we did not get the vaccine, but we will do them once we do. That will really be our first attempt to vaccinate a group, particularly 65 plus, because it's the first time we've been able to. And we're working with TCAT and Gadabout to set up a transportation mechanism to get them up to the mall for vaccination. So we will work with organizations, particularly senior housing. Once we get beyond that point, we'll be looking at other mechanisms to try to alert those that are eligible.
So another follow-up that we did get in is, why haven't we just created a list of people in the county and then inform everyone when it's their time?
Yeah, we've gotten that question a lot. We talked a lot about it last night with the legislature, because a lot of people are asking this question. And really, most of what we're hearing is about the 65 plus population. And quite frankly, until this week, and now, unfortunately, it's likely going to be next week, we have not had doses that we could give to 65 plus population. The state had restricted that to pharmacies and the state sites. And we don't have access. We don't have special access to either of those to get people registered. And it does require collecting health information in order to register someone. So creating a list without having access to a vaccine for those folks, it felt like it wasn't serving a purpose. And we recognize that if we open a list, it's going to be 10,000 strong within a week. And a list of 10,000 people isn't really a list, right, at that point. And we also want people to continue to look at the pharmacies and particularly the state sites if they're able to get there, because they're getting the most doses and are able to vaccinate anyone that's currently eligible. So we absolutely understand the frustration. We have not had access to 65 plus doses. So we have not been looking to vaccinate that population, unfortunately. But we will continue to look to see if there is a way for us to do a wait list, how that might work, if it makes sense, and how we communicate about that moving forward.
All right, thanks, Frank. I'm going to give you a moment to think a moment, and we'll go over to Jason on this. And Frank talked a little bit about this, but why can't the county vaccinate people 65 plus? Who's making that decision?
So right now, the state has prohibited localities from vaccinating the 65 plus population. The only place that can happen is through the pharmacies, which we have four pharmacies here locally that are doing that, Kinney Drugs. And then the other options for folks are the state mass vaccination sites. So the closest to us would be in Onondaga County and Broome County. Unfortunately, if we had that option, we would definitely be, I think, including that group. But right now, the state has told us and prohibited us from doing so.
All right, thanks, Jason.
Mhm.
We talk about the comorbidities. So Frank, what is the change with the comorbidities? If a person's not over age 65, but they have a pre-existing condition, they can be vaccinated, but when do you think they'll be able to be vaccinated here in Tompkins County?
Sure. So first thing they should know is they're currently eligible at the state sites. So that's their first best place to look for an appointment if they have the ability to get there. We are focusing on 65 plus because we've heard that we need to make more inroads with that population. We also know that 65 plus in and of itself is a risk factor. And then if you put comorbidities on it, it just increases that risk. So they're an extremely vulnerable population, and that's where we've chosen to focus at this point. Obviously, as we move through that and vaccine becomes more readily available, we will of course open it up to more populations to get vaccinated here locally.
And Jason, as far as comorbidities, how does someone prove they have a comorbidity or pre-existing condition?
Sure. So it does not require that you share any private medical information. Or what will happen here in Tompkins County is you'll be required to complete an attestation form. That attestation form can be filled out and printed from our county website, the health department website, or you can get it when you go to get your vaccination at the vaccination site. Either way, it's acceptable, but it's just an attestation. If you're going to have it, if you're going to go to a state site, you'll complete a state attestation form when you register for the state site.
All right, thanks, Jason. I'm going to turn it back over to you to continue to ask them questions.
I'm being profound again. Well, and I'm just very quickly look at some of the questions that came in as well. Just generally, Frank, there's a question about, is Tompkins County getting Moderna or another vaccine? Which one is coming to Tompkins County?
So we've been primarily getting Moderna. Everything we've done at the mall has been Moderna. The pop-up site that we're doing on Friday will be Pfizer because that's the vaccine that the state has provided for that site.
And McGraw House and Titus Towers canceled because the vaccines aren't coming. Were people already registered, and what happens to that registration?
Sure, a handful were registered. We've been working with the leadership at both of those facilities, and they're gathering information from individuals that want to get vaccinated, and they'll be supporting the registration process. They're aware that we've had to postpone, and as soon as we're able to reopen registration, they'll help facilitate getting that completed.
Okay. Lastly here, if an adult has both vaccines and becomes positive, can you give it to the people or children who are not vaccinated? I'm not sure I understand this one.
Yes, yeah. So if, for example, if you were fully vaccinated and somehow the vaccine didn't work for you and you became positive, you would need to go into isolation just like anyone else. The vaccines are not 100%. We know that. That's why we need everyone to get vaccinated to create that herd immunity. But if you were to become positive, even after having been vaccinated, you would need to be isolated so not to infect other people.
All right. Thank you, Frank. Jason, the question that's come up is, do I have to pay for a vaccine? What documents do I bring to my appointment? Insurance card, driver's license. You mentioned earlier the self-attestation form. But more importantly, do I have to pay for it?
No, you don't have to pay for your vaccine. What documents you would bring to your appointment is a health insurance card if you have one, or Medicare Part B. Your driver's license or a government issued photo ID if you have one. The self-attestation form, if it's applicable, if you have comorbidities and getting the vaccination through that eligibility. And also depending on what category or what eligibility you may fall into, you may need a letter from your employer or a work ID badge or some type of pay stub to identify that you fit in that category.
Let me ask a quick follow-up, Jason. A lot of people don't have government issued IDs. What happens in that case? Are they turned away? Are they?
In this instance, so most of the subcategories so far, there would be some form of identification. In instances where we are reaching out to the homeless population and some of the providers, it's not going to be a required element of vaccination.
Thank you. Another question for you, Jason. Do you recommend we wait to get the shot in Tompkins County or try our luck with the state site?
We recommend that you get it any way you can with respect to location. While we would love to vaccinate all our folks here in Tompkins County, if you can get a vaccine at a state site, by all means, we encourage you to do that. That said, if you have an appointment set up for late March and you can continue to check and maybe get one locally or get one earlier, we would encourage you to do that as well. Please continue to try to get a vaccine if you're eligible for one.
And as a follow-up to that, a question that just came in, what about people who are not tech savvy, who don't have access to computers to try those sites you just mentioned?
Sure. So right now we're working with 211 for folks to assist them with registration if they need some support with it. We also know that a lot of folks have a lot of family support and other support to help them with registration. So if folks need that support, they can call 211. 211 will help walk them through that process.
Okay. Thank you. And I know there's some other community partners who sometimes will help people as well. So thank you for
Absolutely. Absolutely.
Frank, when I pivot back to you, can Tompkins County offer transportation assistance to get us to a state site or even to a local site?
Yeah, so locally, again, 211 is the place to call. We have worked out with our transportation providers, TCAT and Gadabout, to be able to provide transportation to local sites here in the county. Unfortunately, we don't have free access to transportation to state sites, but 211 can help direct people to our different transportation options that might be available for someone trying to get to a state site.
All right. Thank you very much, Frank. Amy, I'm going to turn it back over to you.
All right. Well, why don't we take some that had just come in about this? One of the things was mentioned was a state site. If you get your first dose at a state site, could you then get your second dose back here at the Tompkins County site, Frank?
So what we really want to encourage people is that wherever you get your first dose, you need to plan to get your second dose there. And the reason for that is for every first dose we get a matching second dose 4 weeks later for Moderna, 3 weeks later for Pfizer. So we only get enough second doses for the people that we gave first doses to. So we're not really in a position to provide second doses for individuals that got their first dose somewhere else. That being said, we do have a place on our website for anyone that may have missed their second dose appointment to put their information in. They then go on a standby list for second doses if we have any drawn that need to go into an arm during an event. Then we might call them to come and fill those spots. But I would say, one, please go where you got your first dose because that's your best case. And please, please, please make that second appointment. If you're in isolation and quarantine, that's a good excuse for not going to your second dose. Otherwise, it really needs to be an emergency reason. This isn't something that we can just reschedule. When you get your first dose, you leave knowing when your second dose appointment will be, and you have weeks to figure that out. So please, please, please try to make those second dose appointments where you got your first dose.
And I know you can kind of plan ahead with the doses because you know that second dose appointment has to happen within a certain time frame. So when you're scheduling, just remember that you're going to need to be back at that location in the upcoming weeks. So Frank, a little bit about when you provide the vaccination links to a subset of a population, how much lead time do people have to sign up in that 1B categories?
So the way that we've been doing it is we're generally alerting employers that we are going to be doing their group in any particular week. And then In some instances, we give the employer what we call an embargoed email with a registration link in it for a certain time, and then all of them distributed out to their network of employees at the same time to try to give everyone equal access. Then from there, it really depends on demand, right? For some of the smaller groups, they've had hours, sometimes a full day of access to slots that they could register for. For pre-K through 12 to date, they've never lasted more than 5 minutes. So it really depends on the demand in those particular groups as to how long you'll have access to. But at least we know it's a small confined group of people trying to get those couple hundred slots versus tens of thousands all trying to get those couple hundred slots.
Can I add something to that? I think
Go ahead.
part, and correct me if I'm wrong, Frank, but when there's a point in time when supply opens up and there's more eligibility, it'll most likely be public links that will be made available, similar to the way the mass vaccination sites are functioning right now. Is that correct?
Yeah,
Oh.
kind of like we did back in early January when we had those 2
Okay.
big weeks before the other sites were open. We put out a public link and let everyone that was eligible go ahead and register there.
So until that time comes, if folks aren't eligible, then there may not be a link available. But when they do become available and supply opens up, it'll be more of a public link for folks to latch onto. Okay, thanks.
Yeah, and just to be clear too, we're not making to date, we have not made public links for 3 or 4 weeks, right? We are giving them directly to the targeted population. So for those that are in an employment group, talk to your employer because they're the ones that we're working through to get the link out. That's really how you're going to see it. As we're moving into the comorbidities, we're working with senior housing that has direct access to those folks. And so they'll be getting it through there. It's not that you have to keep looking on our website. We will let people know if there's going to be a public link on our website before it's posted.
All right. So I'm going to jump back to some of the other questions that came in advance. Is there any time frame for when the vaccine might be more widely available? We're talking about eventually being able to post those public links, but any idea on what's happening there?
Yeah, it's hard to know. There's a lot of good news on this front. The federal government has made more vaccine available. They've made commitments to buy more vaccine. So we're hopeful that our allocations will continue to grow. This is a bit of a double-edged sword too, because we may have vaccine available sooner if people are not willing to get vaccinated. And so we've really got to continue to encourage, everyone that's eligible to get vaccinated as soon as they can. This time of supply being outstripped by demand, it's going to end soon, within a few months. And at that point, we're going to have to continue to try to encourage everyone to get vaccinated because we need to reach that herd immunity number. So a time is coming. It's hard to know when it will be because supply is really what's driving it. But it's going to be important that we continue to ask everyone to seek a vaccine when it's available.
So Frank, we announced about the change in our clinics due to weather. Can you talk a little bit about what that means and what happens with those canceled doses and what's happening to the supply chain there?
Sure. So this is the first time it's happened to us. So I don't really know what's going to happen. Really, the information we get is from the New York State telling us you're getting this many doses. And then we get a tracking slip, just like when you do something with FedEx or UPS, it says your doses are on the truck and when to expect them to arrive. That's really all we know. What they've told us about this is that the vaccines got held up due to weather and had to be recalled. I don't know what that means. I don't know where they go. I don't know. Hopefully we'll find out. If everything goes great, maybe we get twice as many doses next week. That's my hope. But I don't know that we can count on that. So we're really just expecting next week's allocation to be similar to a week's allocation. If we know more, we'll certainly share.
And why are there the differences in different counties? So places like Onondaga County may be still having their clinics and we're canceling ours. What's the difference there?
Sure. So a couple of things. Second dose clinics that have been scheduled. The state is doing everything they can to move doses around that are currently second dose allocated to make sure folks can get those doses this week as they were scheduled. So there's a lot of effort right now being focused on trying to make that happen. There's also allocations that come to the state from different sources that are being used for, say, the state sites. And also there's some vaccine that's being federally shipped now directly to federally qualified health centers and some pharmacies. So there's a lot of different mechanisms on how the supply chain makes its way to the individual getting vaccinated. All we really know is about what's happening with ours right now, which is that we're unfortunately not getting this week's. I would encourage folks to look out if they have an appointment this week to, for any announcements from the people they've registered with about any changes. But unless you hear differently, certainly go to your appointment as it was scheduled.
And I think that's a follow-up is the pharmacy supply. Has this also been affected, or do we know that at this point?
Yeah, unfortunately, I don't know. We found out about our supply today. I do think it is going to impact some pharmacy supply, but I don't know that for certain. Again, if you've registered with a pharmacy and have an appointment for this week, I'd look out for notification from them, and or you might even call the store to just find out if you're still a go.
All right. And the last piece is, if we were to get a larger supply of vaccine, what would we be doing differently, and what can people expect in the months to come?
Sure. So if we had a larger supply, the first thing that we would be doing is having regular clinics at the mall site, right? We can do the most people there in the quickest amount of time. And so that we would be focusing a large amount of our allocation there. Of course, we understand that that doesn't work for everyone. And we do have a county plan that's called a medical countermeasures plan. And it's just fancy words for how do we vaccinate large numbers of people if we have to do it quickly. And in that plan, we have locations throughout the county that we've pre-identified that would take us out into the rural parts. GIAC, Beverly, J. Martin were a part of that plan. That's why they were selected for the pop-up by the state. And so we will take vaccine where it needs to go in order to make sure everyone has access, particularly when we have enough supply.
All right, thanks, Frank. I'm going to give it back to Leslyn to keep asking more questions.
And I do have more questions, and there are more questions that were raised than some of the things that you said. But, Jason, I'm going to go to you, actually. And this is a biggie for me, because we know that several segments of our community have concerns about the vaccine, the safety of the vaccine. A lot of people of color and a lot of other marginalized groups who, historically have had issues with vaccines, have been experimented on, have been any number of things, are concerned. If we're worried about the safety of the vaccine and about side effects, where can we get more information about it that will ease our mind and make us get it? Because we do want all our people vaccinated.
Sure. So vaccine efficacy and education is a big part that our public information team has been working on. There is quite a bit of information on the county website. It's also translated in different languages specific for our community. Another big thing that we're doing also is we're having office hours with physicians. So for example, past office hours so far have been a general open session with CMC. Dr. Hamilton from Cornell Health did a focus group for people of color. A session with Reach Medical. There's a session with Northeast Pediatrics. All of these have been recorded on our YouTube channel. Also, we had one conducted with Catholic Charities for the Burmese refugee immigrant community with live translation. Upcoming events, we have one next week, two of them next week for older adults, along with one in Spanish translation as well. So we're doing a lot to try to reach out to different subgroups in our community. We also, I think, one to be scheduled is an office hours in Mandarin, an office hours for our veterans, and additional office hours for people of color. And these are physicians that are live answering questions. Some folks can register ahead of time to ask questions. Some folks don't have to. But we're trying to reach out to all of subgroups in our communities to provide them with good information about the efficacy of it, because at the end of the day, we want everyone to get vaccinated. And I'll double down on what Frank said is, part of the when we do get increased supply and we do increase the operation at the mall site, we're also finding a way to meet folks where they're at, and identifying those barriers and helping overcome those barriers is going to be a big part of that operation as well. So we want everyone to get vaccinated, and we want to do everything we can to provide the right information to folks.
Okay, thank you for that. And I'm happy to hear that in Tompkins County, we are doing a lot in terms of, just trying to reach people where they are.
Absolutely.
Whether it's language or communities. So I really do appreciate hearing that. Frank, us keeping in the same vein of sort of, just side effects and so on, what is the CDC's vaccine adverse event reporting system, the VAERS? Why is it important to report side effects from the vaccine, and what do they do with this information?
Sure. So VAERS is a system that's been around for quite some time. So for any vaccine that's administered, if the individual has an adverse event, has significant side effects, the person providing that vaccine is required to report that through VAERS, which the CDC then monitors. And they monitor it for a couple of reasons. One, obviously, if there's significant events related to a particular vaccine, they want to know that. And it doesn't necessarily mean the vaccine is bad. There could have been a bad lot number, right? Or something that went wrong with a particular production. Very rare that ever happens, but of course we'd want to know that if it did. And then a second component is they use that data to compare it to the studies that were done when vaccines were approved, right? So you do studies and present that data to the folks that review vaccines and for approval, and it tells us that these vaccines are safe. We want to compare what's actually happening with the broader population to those studies to ensure that it aligns, and that's another really important reason for the VAERS system.
Okay, thank you. That's good to know. There are a couple of other quick questions that came in the chat that I just want to follow up on. One has to do with the vaccines and what is being done with the doses that are not used at the end of the day if there are cancellations or no-shows.
Sure. So there's a couple of components to this. First, we are so fortunate to have the partnership with Cayuga Health Systems, because at the mall site, their pharmacy team is there and they are handling and monitoring all of the vaccine. So they only pull vaccine from a vial if they know there's somebody there to take it. Where we might have doses left over is each vial has 10 or 11 doses in it if it's Moderna. And once you puncture it, even for one dose, you then have to use all the doses in that vial. So there's been an instance where we've had one person show up and we didn't have a vial, and we asked them to come back the next day. So rather than puncturing that vial and then having to find 9 more people, it was more effective for us to ask that person to come back. But there have been instances where we've had 2, 3, 4, 5 people. So obviously it makes sense to puncture the vial. And then from there, we have very limited standby lists. So for second dose people, a second dose can only go in a second dose person. That is like written in stone. That has to happen. So we look at people that didn't show up that day. We call them. We look at people that are scheduled for the next day. If they are, we call them. If we really get desperate, we are supposed to call the hub that is looking at the region and tell them, hey, we've got these second doses. Are there other places where you could send somebody here to get a second dose in the region? To use up those doses. Thankfully, we have not had to get to that point because our pharmacy group monitors very closely. As far as the first doses, similar thing. We have a standby list, a very short one, of people that are in those eligible groups. So first responders, some of the other folks that we've already vaccinated. Remember, I said we think we substantially hit those groups, but we know we didn't get everyone. So as we hear about them, they get put on the standby list. It's a very short list because we generally are not looking for large numbers of people because we do manage the vaccine so closely.
Okay, thank you. So vaccines are not going to waste, and I think that's important for people to know. So thank you for that. And then there's a question that it's not necessarily related to vaccines, but it's related to reporting. And I'll just ask you quickly, Frank, why does the state list a conflicting number of deaths to what the county reports on our health department website?
Yeah, we get that question a lot, and we are trying to figure that out. We have been communicating with the state to try to understand what numbers they are using. The health department here locally runs the vital statistics office. So anyone that is born or dies in Tompkins County gets their birth or death certificate through us. So we're combing through the certificates as they come through. We're just trying to match up what the state is calling a COVID death versus what we see in the death certificates, and that's just been a challenge to date. It is unfortunate. It's not that there's a difference in what we're calling a death. We just haven't been able to get clarity from the state about what they are, and so that's why we're seeing that discrepancy at this point.
Okay, Amy, I'm actually going to stop and turn it back over to you for other questions.
Sure. So we just had a question come in about our partnership with 211. And Frank, do you want to talk about that partnership and what 211 is able to do and what they're limited on? I know some people are hoping that they have actual registration slots. So if you can talk a little bit about what 211 is doing, that'd be great.
Sure. Well, 211's been an amazing partner, and we really do appreciate them. They've stood up pretty quickly with some county support, being able to take a lot of calls about vaccines and other COVID matters. But so they can answer questions. They have access to a lot of information, both that provided by us as well as on the state websites, and they know our local systems. They can help with transportation to get vaccinated if need be. The one thing that they can't do right now is register people. And really the reason for that is they don't have access to slots, right? The ones that the county is operating, we are giving directly to certain groups, and we're working with those groups to get people vaccinated. So there isn't really a need to call in for those doses. And for the 65 plus population, which is the one we hear about the most, and now comorbidities that have been added, the only real place to get those is at the state sites or at pharmacies, and 211 does not have access or special access to those websites, and they would need all of your information in order to register you. So they would be doing the same thing you would be doing, was going to the website, seeing if there's a spot there, and then talking through, getting somebody registered. And in order to do that, the slots are gone. Right, so that we don't want people to feel like you can call 211 and get an appointment, because they have no special access. They have the same level of access that you do, and would simply be doing the same looking that you would be doing on your own, and likely would take longer because they don't know all of your information the way that you do.
All right, thanks for that, Frank. And a question about Friday's cancellation. People received an email saying if they had registered that it would be canceled and it would be carried over to the next registration. Does that mean that they'll get the same time slot and be, kind of can expect that it'll follow the same registration, or will they have to choose another time and go through the registration process again?
Yeah, I don't know the exact answer to that yet. It is our hope that we will get the same amount of doses or more than we were expecting this week, next week, and then we'll just set up a day the same way that we intended to set it up, and therefore they would be able to keep their time slot moving forward. But I can't guarantee that. If I get half the amount of doses next week that we thought we were getting this week, we're gonna have to do some maneuvering around appointment slots and where they are and how it works. So we will get to them. If they have an appointment, we will work with them to get them another slot. And just hang tight. As soon as we know what we're doing, we will be reaching out to those people to give them direction on how to move forward.
So I'm going to go to you, Jason, to talk about the pop-up clinic. So that is still happening this week. And can you explain how that pop-up site was selected and why we chose GIAC and BJM?
Sure. So pop-up states, pop-up sites, I should say, not pop-up states. Pop-up sites have been done all across the state. It's a state initiative where they are identifying marginalized communities or areas in different communities where folks generally have barriers. And they've allocated specific allocations of doses to set up a pop-up site in those different communities. So we were identified, City of Ithaca was identified for a pop-up site location, and per that state initiative, BMJ and GIAC was identified as a location to provide that distribution of that vaccine. Generally, these pop-up sites are meant to meet people where they're at. A lot of times focus on different in areas and communities of color. They're designated to serve the immediate neighborhood. A lot of times intended to be walkable, which in this case it would be downtown. And a lot of times they're meant to serve populations that have limited access to vaccine due to other barriers. So it's a state initiative specifically. The state was the one that approached us and selected this location specifically. And I wouldn't be surprised that if we have more in the future, they may be at this site, they may be at others as well. Similar to what we intended to do with the comorbidities, where we identified Titus Towers and McGraw, a similar type concept, identifying a certain population. And we'll continue to take that allocation when we get it from the state and continue to administer it to different subgroups in our community.
And to follow up on that, Jason, did we select the GIAC site, or was that something that the state identified?
The state identified that site.
Okay, thank you.
Mm-hmm. Yep.
And Frank, who can get vaccinated at that pop-up clinic, and how do they register?
Sure. So the good thing about those pop-up doses is anyone that's currently eligible is eligible for those doses. So we've actually done two things in partnership with GIAC. We've worked with their senior program to actually reach out to and register 100 seniors into that clinic. So we actually did a proactive reach out to those individuals to get them registered. Then the other 100 doses, GIAC has distributed that link through their network that they already have in place for folks to be able to click on the link and register. I know the senior population, all 100 have already been filled, and I know we're close on the other 100 as well.
And Frank, can you talk about additional pop-up sites? Could there be pop-up sites in the rural community and other places throughout the city? Is that a trend we should expect to see more of? How is that determined?
Yeah, so a pop-up site is essentially the state's special allocation of additional doses for this particular area. I don't know if there will be more. They've been kind of popping up in different places around the state, and I imagine they'll try to get to a lot of locations before another community gets a second one. But what I would say is a pod or a point of dispensing in a rural community is part of our plan. We just don't have the doses to do it yet. And there will absolutely be opportunities in the future when we have more supply for us to open pods in some of the rural parts of our community to create access for those folks that might struggle getting to a site at the mall.
Okay. And as far as future information, other pop-ups, any other ideas of things that are coming, where do people find that information, Frank?
So our health department webpage is a good place. I think we now have like 3 pages of COVID information for vaccines and the history and then general COVID. I know there's a lot there. Probably the best thing you can do is if you go to our webpage, there's a place to sign up for our distribution list. And we created that probably 6 or 7 weeks ago. And we've got 12,000 people now, I think, that are registered for that. And you will get a direct email from us on all of the information that we put out, including our press releases. So that's the single best way to actively get information from the health department as we develop it and put it out. So I'd encourage people to go take a look there and register their email address.
Right. That is getting close to the ending of our questions. I do have a final question, unless Leslyn, you have any other questions before I go here.
I don't, Amy. I was just looking through to see if there are any others that came in, and I don't see. Oh, wait a minute. There was one other question quickly about talking about setting up an office space for volunteers to help people set up appointments. People who are worried about those who aren't, computer savvy, who don't have access. Is there, maybe that's a Jason question, I don't know, or you, Amy, is it the potential that we could look into something like that, and how would we make it happen?
Yeah, I think this is, and Jason, Frank, please chime in. This is something that we have been trying to figure out for a while. I think the biggest challenge is not knowing when we can register those people and get them into those different queues. So I think it's an interesting idea. I don't know, Frank, Jason, if you have other thoughts on this.
Yeah, I mean, I think, you hit it that we don't, we've been limited to the population that we're able to serve to date. And that population have been essential workers. And we're working through their employers, and we're asking the employers to help their employees get access to be able to register through a link to the site. When we start moving out to broader populations, 65 plus, those with comorbidities, we've gotten such a small allocation. We've chosen to first focus on 65 plus with comorbidities, and then to look at our senior housing facilities at a place where we can go to them and help them get registered through the facilities and the organizations that they're a part of. So we are actively working with every dose that we get to try to make it available to populations and help them get registered. As far as when we get to a point where we have enough doses that anyone that wants it, or that there's readily appointments available, we absolutely will have systems in place where people can call and register. And we can certainly talk about whether there's other options. It's simply the lack of supply and appointments that are currently available that you can call us, we don't have anywhere to register you. And so until we're in that position, we're trying to take the vaccine and the links to identified groups that we know we can help get registered and that are priority vulnerable individuals.
Yeah, I think you hit it, Frank. There's a lot of great ideas on how we can try to continue to help people get access. And I know the patience is being worn thin, because we want to get people those vaccine doses, and it continues to be a challenge on how to get them registered when we just don't have the supply yet. So that is the end of the questions I have, unless there's anything else, and I don't see anything on our side of things at this point. My final question is for all of us, and I'll start, let's start with Jason. And what is giving you hope right now throughout this pandemic?
I think what's giving me hope right now is the commitment that we have from a lot of different community partners to be flexible, to be nimble, and to find solutions. We've done this throughout the pandemic, and now where we are at a point of vaccinating folks, the fact that we continually get, I think, more vaccine than most counties is because of the performance we've had, and that's because of the partnerships we have. And CHS is a huge partner in this. There are a lot of other community partners that are helping to bring solutions to the table to help folks to get the vaccine, to support them in a time of need. And while we are waiting on supply, I feel that when that supply comes, we're going to be able to take off. And so that gives me a lot of hope. We're not sitting here sort of asking ourselves, we don't know what to do. We're asking ourselves, how do we get this done, and what's the way we can do this? So that for me gives me hope.
All right, Frank, I'll go to you next.
Yeah, I mean, we've almost vaccinated 10,000 people, right? It's amazing. And Jason hit on it. We wouldn't be able to do it without the partners in our community. And it's great to be working on the solution, right? For almost a year, we were solely focused on trying to keep the disease under control. And that's just a mitigation measure, right? That really wasn't a solution to the problem. This is. And to be able to go to the pod at the mall and, you know, have people just thanking the staff working there profusely for helping them, you know, giving them the vaccine that's going to keep them safe. It's great to see that look in people's eyes, right? It's a different look than we've seen for almost a year, where there is hope and folks are starting to see the light at the end of the tunnel. And that's what makes this part of this response exciting, because we really are moving towards a solution. And I'm excited to continue that and look forward to more and more vaccine coming so we can vaccinate everybody.
And Leslyn.
You want me to say something profound? You know, I believe it was Aristotle who said, excellence is not an act, it's a habit. You know, we are what we repeatedly do. And in Tompkins County, I want to blanket the work that we all have been doing in managing this pandemic and trying to provide for our community, be it response to needs or at this point a rollout of this vaccine. We have risen to the occasion with a level for me of excellence, not perfection, but excellence. And that gives me hope that as we continue to do what we are doing, that we will eventually perfect it and all of our community is going to be better off. So I want to take this time to thank all of you, thank all of our residents for their patience. I know it's difficult, but we all have to be patient. Our federal government has promised us that they are buying more and more vaccines, as Frank said, and the supply will very soon, you know, outweigh the demand, and we'll have enough for everyone. So thank you for your excellent work as we strive for perfection in this pandemic. Thank you to everyone who continues to endure. It will come as no surprise to you all that I will end mine with saying Happy Black History Month to everyone. I wasn't here for the start of Black History Month to say that. And I say it with purpose because the state identifying communities of color, Black and Brown communities that have been disproportionately affected, died by this disease, and not having access to health care and the vaccine, I think that has been great. I remember at the beginning of March at one of the first press conferences, if not, or second press conferences of the governor, I made note of it. And I even sent an email to the governor thanking him for recognizing that communities of color are disproportionately affected by this and that he will focus on communities of color. So it warms my heart and gives me hope when we have a pop-up site that part of the target community are people of color and other marginalized groups and our 65 plus residents. So yes, it gives me hope that we are on the right track. So continue to shine, in the words of Aristotle, and wear your mask, wash your hands frequently, don't touch your face, keep 6-foot distance, even if you've gotten the vaccine. It is incredibly important that we continue to follow those basic guidelines. We've done well in this community. Let's keep doing even better. Thank you.